Tonight I need to inform the people of the state of Missouri that the state's first probable case of 2009 H1N1 virus, also known as swine flu, has been identified as a resident of Platte County, Missouri. And I want to detail for you the specific steps that my administration is taking as we speak to minimize the potential spread of this strain of influenza. As your governor, the health and safety of Missouri families is my #1 priority. We're working around the clock to monitor, track, and contain this virus. I want the people of Missouri to understand that this is a situation that could become more serious. But while this is cause for concern, it is not cause for alarm. To put in context where we are, over this last flu season, we had about 9,800 cases of flu. I mean, the flu season's still going, but that's the statewide number, continuation numbers. That's not this. This is a much different strain and situation. The sample from the probable case will now be overnighted to the Centers for Disease Control and Prevention in Atlanta for additional tests. My administration has officially notified the CDC and the Obama administration of this probable case. Now that a probable case has been identified, public health officials will follow typical procedures to notify this particular patient. Under these procedures, public health agencies will provide the patient with antiviral drugs and encourage the patient to remain at home until 7 days after his or her first symptoms. This will help ensure that the patient is no longer contagious. And for those that notice I said his or hers, we're not going to give the name or any other identifiers other than the county residents of the one where the probable case has been identified at this particular point. In addition, under these typical procedures, public health officials will provide instructions to the patient's family or caregivers about how to avoid spreading the illness, and family members also will be monitored for signs of the illness. We're in close contact with the Federal Centers for Disease Control and Prevention and local health agencies regarding this particular case. We are all sharing information and ensuring that the lines of communication are open as we collect new information. Communication between state public health officials, local agencies, and the federal government will be carefully coordinated to ensure that medical professionals have the information they need to keep Missouri families safe. In other words, we get these original tests from medical professionals, labs, they come to us, we take them, we do the tests we have here. If they come out, as this one does, as a probable, then we move those samples on, but we also light up our network. We'll also be taking quick and aggressive action to inform the public about preventative and precautionary measures we all should be taking, such as washing our hands frequently, covering our mouths and noses when we sneeze, and staying home from school or work if we experience flu-like symptoms. Second, we are beginning immediate action to distribute Missouri's stockpile of influenza drugs and move them across the state so the public health agencies and professionals can treat any cases quickly and effectively. Each public health authority will receive its share under an established formula, starting with the affected areas. So the first shipment will go to the Platte County health officials, and we will disperse the rest of these antiviral drugs out across the Show-Me state. We also are receiving additional antiviral drugs and medical equipment from the federal government. As those are here and made available, we will put them in areas that in fact are needed. At this time, we are asking the people of Missouri to do their part to help control this virus as well. Taking everyday precautions, such as getting plenty of rest, exercising and washing your hands, will help Missourians take care of themselves and their families.